Welcome to the Innovation Accelerator podcast, brought to you by Innovator, the data platform that accelerates innovation in healthcare. We're on a mission to connect and curate the world's healthcare information to make it accessible and useful. Accelerate innovation, digital transformation, and your success with population health, customer relationship management, and value-based care with Innovator. Visit us online at innovator.com.
Hello, everyone. Welcome to Innovator's Innovation Accelerator podcast. We are thrilled to be here with all of you today. We have a great program. We have two awesome guests who are joining us today. And they are Ann Greiner and Seth Joseph, who you see on the screen. Ann is the president and CEO of the Primary Care Collaborative. They're a not-for-profit who are working to advance the effectiveness of our health system, largely built on a foundation of primary care. And Seth Joseph, he's managing director at Summit Health Advisors, a company he founded, which is an advisory consultancy that focuses exclusively on healthcare. Seth is also a widely read Forbes columnist, so he works on the intersection of healthcare, technology, and policy. And I'm Sean Hogan. I'm general manager at Innovator. I lead our business serving our health system clients. I'm also a member of the board of directors at the Primary Care Collaborative. My background is in business engineering systems thinking, and my career has been focused on applying those interests into healthcare, particularly developing tech and services from the business side to serve the industry, like what we do at Innovator. And I'll be moderating the discussion today, but hopefully quite engaged in it as well. So our focus topic today is really around two things: the role of primary care in our health system. Primary care plays an incredibly important role, but sometimes perhaps not fully understood, or certainly not fully supported and invested in the way our health system functions. So it plays an incredibly important role, and we think that there's a lot more that it can do. But there are a number of structural, resource, reimbursement, and other challenges related to how primary care is supported. So that's one aspect of the conversation today. The other is around technology, information technology specifically. Healthcare is an incredibly information and data intensive industry with incredible potential for the use of information technology. Yet some would say that that's not yet being fully realized in terms of value into the health system. And so we are bringing these different vantages together to have a conversation about how some of these things are playing out in real time and the impact that it's having on each of our respective businesses, communities, and even just the way that we ourselves interact with the health systems. I'm going to start with Ann. I'll give you a little bit more about Ann's background. She'll tell us more about the work that they're doing at the Primary Care Collaborative. But Ann she's devoted her career into healthcare, over 2 decades of experience. She's had senior level roles in policy, in research, driving communications around these topics. Prior to taking the helm of the PCC, she was with the National Quality Forum. She was with the American Board of Internal Medicine. Prior to that, the Institute of Medicine, which is now, of course, the National Academy of Medicine, and the National Committee on Quality Assurances. She has her master's from MIT and her bachelor's from Hobart and William Smith College. I also happen to know about Ann that she's an avid rower, so you might catch her sculling on some of the lakes and rivers, whether it's in the Northeast or around the DC area. So, Ann, I know you're very, very passionate about this topic. Could you tell us a little bit more about yourself, but especially about the PCC, what it's doing, how primary care is so important to our system, and some of the work that you're engaged in that has you really excited about the topic?
Well, Sean, great to see you, and very excited to be here today for this conversation. Innovator has been a real leader in lifting up technology solutions to support primary care. We're excited about the work that you do. So just a moment on the organization that I lead as way of context. We're 16 years old, and really we were formed together around a desire on the part of employers and primary care physicians to have a different kind of primary care. And they came together around a model called the patient-centered medical home, which because all these groups came together and then consumers joined, health plans, tech companies, pharmaceutical organizations, all advocating for a different model of primary care, the patient-centered medical home. It took off, and it was widely adopted first by health plans, then by states, and then by the federal government. And it really has helped to transform primary care. However, we have come to understand that it's not as high-powered as it might be because of the payment chassis that it's on. And I think you alluded to this early on, Sean, by saying that, well, we all talk about the importance of primary care, and it's kind of like motherhood and apple pie. It actually is not valued in our healthcare system today. In fact, over the last decade, the percentage of spend on primary care has declined as a percentage of total cost of care. So we say we value it, but we're actually not valuing it. And why do we want to value it? Well, there's an incredible evidence base that when you have robust primary care, and that does require investing in it, you have much better population health, more equity, and actually you even have lower costs. And so just one last data point. Unfortunately, the U.S. healthcare system has been falling behind in terms of health of the nation. In comparison to European countries, Japan, Canada, et cetera. We are now 3 years behind in terms of life expectancy behind the Europeans. And we know that if we rebuild primary care, we'll be able to recoup those differences and get the health of our nation back on track.
Yeah. And say a little bit more in why primary care is so important and how it's making, what's different about a primary care centered model than perhaps the way our health system and model works today?
So I don't know if any of you have had this experience, but it's happened to me countless times. Somebody moves from Europe and they say, like, where is primary care? Because in other healthcare systems, primary care is your partner. It is the absolute front door of the healthcare system and is your partner in navigating the system. It helps you to diagnose what your, what health issues you may have. It takes into account what your values and preferences are as you think about how you want to address those health needs. And it's not ideally just about physical health. It's also about mental health. And if needed, helping to connect you to community resources to address maybe issues that you may have with you don't have enough money to fulfill that RX script, or your budget is cramped at the end of the month, and so your diabetes goes out of control because you can't get healthy food. Right. So the ideal notion is that primary care is really there to help you manage your chronic conditions, diagnose what ails you, and provide a comprehensive set of services, which a single doctor can't do alone. Really, it requires a team to provide the kinds of services that can help restore you to health, or manage a condition perhaps that you may have for a lifetime.
Yeah, and since it's anchored, as you described, around a relationship, it's inherently more preventive in nature and less reactive. And because of that, with a team surrounding a person with an understanding of preference, you can be more, I think, on the front end of engaging a health problem before it manifests itself in a crisis. You had written, among the things that I think you're trying to support and address in the work that you're doing with the Primary Care Collaborative, is payment reform. And you'd written recently, along with the Commonwealth Fund about how we can pay differently for primary care and how that could help us lead to an expectation or realize an expectation for better health and greater equity. Can you just say a bit more about the role that reimbursement and payment has in the equation?
Sure. So, first off, fun fact, we spend across all payers about 4.6% of our total cost of care is spent on primary care.
All right. So, of a dollar of our total dollar of healthcare,
yeah,
4 to 6 cents of that dollar goes to primary care.
Yeah. And, I think the first time I learned how low it was, I was stunned. In fact, we spend 6% on dialysis care. So just think about that. The number of patients that might be on dialysis care versus those that are in the front door of the healthcare system or trying to get into their front door of the healthcare system. So we really are under investing. So it means that we need to shift closer to double digits, and we don't know what the magic number is, but Europeans are spending a lot more, and health systems in this country that are primary care focused are spending a lot more. But we also believe that we need to get off of a fee-for-service system that pays almost like on a widget basis, like for every little thing. And what that does is it fractures care. So you might have had this experience. You go in, to see your primary care doctor, and you have 2 or 3 issues that you want to talk about. And really, there's only time to get to 1 or maybe 2. So what that means then is you got to come back for another visit. And, the visits are short, and they are focused on a particular issue. That's really not addressing the multiplicity of things that patients often bring into an office. And so we are really interested in shifting away from this fee for service, which also drives a lot of volume because, you got to come back and you got to come back again and again and again, very inconvenient, not very patient centered, to a system where you get an upfront payment, almost like a subscription service. So a per member per month fee to keep a patient healthy. And we have lots of evidence that leads to better outcomes. Now, we need to also make sure we've got great measures in place so that we know that, this new payment system is delivering on that value. But we believe that we got to move off of fee-for-service towards this, prospective payment model.
Yep. Yeah, and we're seeing, I think, a recognition of that imbalance of value received and allocation of funding, and we're seeing it structurally in a lot of interest. So, and we're going to come back to this, Anne, but there's like this. We've talked about how the notion primary care has had this moment in terms of investment flowing into entities that have a primary care orientation, and yet in the meantime, there's still almost like a crisis, if you will, in terms of career satisfaction and stress, issues related to burnout in the field of primary care, in spite of this growing interest and increased recognition that it's an important part of the structure. And so let me flip to Seth and give you a little bit on some of his background why I'm so excited to have his perspective on this conversation too. So I mentioned how Seth is the founder and managing director at Summit Health Advisors. They work with companies across the health system. So they work with large organizations like the CVS Health and SureScripts or United Healthcare, also with investors, operators, and entrepreneurs, companies who are trying to engage and find ways to support solutions into this market. And he in particular has been very interested in and written about the notion of network effects and how evolving business models are perhaps playing in a way that can contribute to an evolution of some of the success. His articles, you can see them in Forbes and Health Affairs, Jamia, and others. Seth, he resides in Rhode Island, which he often reminds me is the not yet discovered hotspot of healthcare technology. And Seth, I'm love it if you could share a little bit more about the work that you do at Summit Health and some of the topics that you've been writing about that relate to how some of the challenges that Anne was describing, but also how technology and companies are responding to some of these interests.
Yeah, absolutely. Well, I'm excited to be here and think this is an incredibly important topic. Really pleased to be here with you, Sean, and Anne. I think it's a wonderful time to be talking about these topics. So I don't have quite the policy background that Anne has. I started off my career in healthcare at CVS Health in what was then a pharmacy strategy and innovation group. And we looked at any technology and evaluated it that we would consider bringing into the pharmacy that would touch pharmacy workflow. And I learned a number of things. It was my first foray into healthcare. Pharmacy was this incredibly fascinating and also really underutilized resource within healthcare. So at some point, maybe we can talk about the role of pharmacists and their potential partnership between pharmacists and primary care. But among the things that I really began to appreciate were a few things. One, technology is this amazingly powerful tool that can vastly improve a human being's ability to provide care for another human being. And yet, one of the flaws that I have seen throughout my almost 2 decades in healthcare technology is that technology is just that. It is just a tool. And so technology needs to be intelligently and thoughtfully designed and take into consideration how providers, whether they are primary care providers, pharmacists, specialists, or others, or people, how they engage on an everyday basis with the healthcare system. On the provider side, it is what is their workflow? How do they practice? How do they engage with patients? And on the patient side, it is the recognition, first and foremost, that there is no person who considers him or herself first a patient. We all consider ourselves people, and we have lives and interests outside of healthcare. And so technology that wants to engage us needs to be designed in a thoughtful way, recognizing that we are people first, hopefully not patients very frequently, and that therefore, we can't be expected to manage, for instance, multiple different patient portals. We want one, ideally. And so, likewise, on the provider side, technology can be a very powerful enabler, but it needs to be designed with how providers actually practice medicine. And so we do a lot of work with, Sean, as you said, investors and startups, helping them to understand how to get into workflow, how to design their products and meaningfully get into workflow, how to appeal to the business side, which is a reality of healthcare. The recognition that, as Anne has said, today, much of healthcare is still based on a fee-for-service world, but there is a movement towards fee-for-value or value-based design and value-based payments. And so there is a lot of nuance around how you try to bring technology to solve problems and help providers provide better care, higher quality care for patients and populations at scale. And then the final part of where we focus is this recognition that so many problems in healthcare are a result of incredible fragmentation of our healthcare system, quote unquote, because a system, Sean, you know this, you mentioned being systems oriented and systems design thinker. I think Jonathan Bush said it really well when he said that we don't have a real healthcare system, or we don't have a healthcare industry. It's not $4 trillion of market spend. It's more like thousands of $1 billion of market spend. There's just so much fragmentation and so many different interests. And what that results in is a set of problems that present themselves in terms of information asymmetry. People don't have the same information that each other or that they need. Coordination challenges, communication challenges. The long tail that we have in so many different healthcare markets makes them oftentimes economically inviable for companies to develop solutions for and bring them to market. If what you are doing is selling just technology, and yet if what our business is, or what an entrepreneur is focused on addressing, is solving problems between constituent groups, then that starts to afford a very different way of thinking about what a business model can be, which is, rather than selling technology or a solution, you are selling or bringing a solution to market that addresses connectivity and coordination challenges. And so, Sean, you mentioned network effects. I think that there are massive, massive opportunities for companies who are bringing solutions to market that benefit by and even are driven by network effects. The idea that each individual user adds value to the product itself because they each represent an additional node on the network. And as you get more nodes on the network, you can coordinate and communicate more with a wider and wider, or broader and broader network. And you can start to solve different types of communication, coordination, demand and supply matching types of challenges. And so I think a lot of that presents itself in terms of the types of challenges that we see in primary care. And so excited to be here to speak with you. And I'll pause now. And
I think you framed it really well. And when I think of the challenge or the role that primary care plays, they often are a connector, right? Because they are connecting many aspects of your health needs and helping connect an individual with access to health resources. And yet it has been a real challenge for that part of the system of healthcare to really get effective use out of technology. I think it's often it's felt like it's been more of an administrative burden and an enhancement to those who are in the practice of care. And maybe you could, and I know you've written on this notion of tequity, right? So does technology truly contribute to advancements in the field, or does it impede it in some way? And how can we maybe just say a little bit more about why it's hard, and what are some of the things that you see working that is perhaps indicative that we should continue to believe in its potential to really make a difference?
Ooh, that's a big one. I had a thought as you were talking, Sean, which was, there's been so much investment poured recently into this idea of a digital front door. And, Anne, as you were talking, my thoughts were, wait a minute, can't we just get the darn front door working before we focus on making it digital? And so, as I think about this idea of tequity, it's the recognition that technology can be an enabler and a conduit for improving access and improving or increasing the likelihood of generating more equal quality of care and more equal outcomes, or it can be a barrier. And so it comes down to, I think, a number of things. And I don't want to try and oversimplify or try and answer it in full here, but I think a lot of what thoughtful design of technology comes down to, it starts off with ensuring that there's good representation of different viewpoints and diversity within a team itself building the technology, including that there is a clinician's viewpoint and voice, and patients, or at least that people who are building the technology think of themselves, their friends, and their family, and how they are going to interact with or experience the technology. And so I think that tequity should be a part. I think health equity is increasingly being appreciated, receiving a lot more visibility. And I think every founding team, technologists out there, folks who are working in on software development need to take into consideration who the populations that their technology are going to wind up serving, and ensuring that they are designing their solutions in a way that will lead to the most likely equal outcomes and equal quality of care. And that requires, I think, ensuring that there is representation from voices who will be thinking about those who historically may have been underrepresented.
Yeah, and I'd love for you to weigh in on this. I know we've been together in meetings where we can feel the tension that those who have devoted their careers, their professions to engaging in primary care services are frustrated by how the system, collectively, how their role is being appreciated, and then how they're being supported. So, how are you seeing this challenge, and what is it? How is it playing out with some of the stakeholders for the PCC?
Well, first, I appreciate that Seth is bringing this whole notion of equity into how we talk about technological innovation, because I think that's really important for us not to get enamored with new toys without thinking about, the effects on different populations. So I think that's really important. And, as you were talking, Seth, I was really thinking about, the ideal, I think, is technology that is supporting the primary care clinician-patient relationship rather than fragmenting it. So, for example, if I have diabetes and asthma, and I'm presented with two different apps that are generating different information and asked to manage those, and I don't have anybody who's receiving the data and interpreting it and helping me to manage these conditions on the other end, I'm pretty lost. And in fact, you're asking not you, but I think, some of these innovations are asking the person at the other end, the patient, if you will, to be their own general contractor and figure out how everything comes together, and, manage this information overload. Really not ideal. So, in what ways can technology support that relationship and help patients to get the support of these new apps, these new innovation, while at the same time it's not it's supporting the primary care clinician on the other end. And so I think that to me is the challenge that I would hope the innovators would work on, because I think there's different ways to use the same set of tools that could really be a game changer and could really help and integrate and coordinate care and really support primary care clinicians. Or we could end up, with more fragmentation and more data and a lot less information. So, I think that's really our collective challenge. How do we do that? And and I think it's a real challenge for employers that are presented with all of these new ways that they can, new apps that they can use and new innovations that are going to deliver incredible health effects for their employees. And yet, I hope that they're thinking about how does that interface with primary care and how will that really support this important relationship? Because I think a lot of the studies have shown us that technology alone is not going to get us to the outcomes we need. You need to have a coach. You need to have someone that you interface with that helps you interpret that data, and that is helps you to navigate it all.
Yeah, and I just to pick up on what Seth was saying, that technology isn't the answer. It's really an enabler to what it is we're setting out to do. So maybe, Anne, tell us like some of the things that you either from a policy perspective or what we think primary care is so important in helping us realize from an outcome of health or equity or other value to individuals, communities, or our society. And then, there's an inherent fragmentation of healthcare structurally that we have to deal with, and even the structure of primary care. But perhaps then Seth can comment a little bit on, well, what are the ways that we can maybe think of, if we're thinking of the kinds of solutions that you're advocating that primary care can be central in resolving, then maybe some thoughts on, okay, what we might do either structurally from a realizing what technology can do to help support that. So can you go further,
Sure.
Anne? Yeah, just on.
Sure. Well, in some ways it comes back a bit to, what's the objective of our healthcare system? Because the objective of our healthcare system, I don't think anybody would say, is to do more stuff. I think the objective of our healthcare system is to keep people healthy. So how do we do that? And do we have the right measures in place to incent our system? And do we have the right payment models in place to incent our system? So right now, there's lots of incentive to drive, lots of volume in many domains. How do we get our system oriented towards being incented for keeping people healthy, keeping people from needing to be hospitalized, go into the hospital? That's very expensive and very disruptive. We do need specialty care, but a lot of things can be managed in primary care. So I think of the right kinds of measures that could help us. So if you were giving a prospective payment, a payment in advance, I'd want to see that your patients said that their care was being integrated and coordinated, and that their questions about how to manage their care were being addressed, and that they were true partners in helping to manage their own conditions. So what are those measures? Some of them don't really exist. What's a measure around, care coordination from the patient's perspective? What's a measure around care integration from the patient's perspective? How do we measure, a relationship that leads to better health? So these are all things that I think we have to work on and link to payment. And then that, I think, can drive our system in a really, really different way. And technology is absolutely critical, because you need to be, collecting this data, not just on patient-reported outcomes, but then on these clinical outcomes. And how do we know that a new payment model or a new way of delivering care is actually getting us to better health outcomes? Our life expectancy goes up, not down, and we're closing equity gaps between, white, black, brown, rural. Those are getting closed.
So I'd love to jump in, Sean, if you're okay
Please.
with that.
Yeah.
And you just said a number of things, and I want to that I thought were really interesting, including asking the question, what is the objective for our system? You also said earlier that we don't value primary care. And I want to be really clear. The stats you provided that we invest 4 to 6% of our healthcare expenditures on primary care. That is a shockingly low number. So I agree with you. And there's been enormous investment by private investors, private equity, venture capitalists, corporate investors into primary care probably over the past decade or so, and it seems to be accelerating. And so we see this in the form of startups, like if it's okay to name a few without endorsing any. We saw One Medical, we've seen Carbon Health, we've seen Oak Street Health, Iora Health, which is now part of One Medical, which is part of Amazon, which of course is a bigger story. Oak Street and Carbon Health have both received investments or been acquired by CVS Health. United Health Group is out there and it now has been acquiring physician practices, and I believe is the largest employer of physicians nationwide. And I think at least one of the drivers of this activity is the recognition that as we move from a fee-for-service system to some type of fee-for-value system, that there is a recognition that primary care is this critical fulcrum. It is the front door to the healthcare system. It should be, at least. And I think, Sean, alluding to a point you just made a few minutes ago, it's still going, and Anne as well, it's going to be people helping people to navigate through the healthcare system. And so it seems like we're starting to see a lot of momentum. And I suppose, Anne, my question for you is, investment is one thing, and individually, these companies tout, quite impressive outcomes, and they've published in many cases. So I think these outcomes are credible. A question is, are we seeing the outcomes sort of ripple through the broader market? Are we seeing progress made, or are we seeing progress made just by the select few who have the capital to make these investments, and are some being left behind?
Well, so I just want to underscore that we are seeing a lot of money flowing into these new arrangements, and a lot of focus on primary care. So we're thrilled. And I think we don't have great data. The latest data that we have from AMA surveys, and also that just was in the primary care scorecard that Milbank put out, is that in terms of primary care and those that are under capitated arrangements, so it's less than 10%. So we're still, there's a lot of interest in all of these new investments. And I think of them more really like really gearing up in the last 5 years. But it's not yet having a demonstrable effect on how primary care is actually being paid at the point of care. That's beginning to shift. I see that that's beginning to shift. And I think there's a growing competition amongst these innovators, for primary care physicians and NPs and PAs. And so in some markets, their salaries are going up because there is competition for bringing in these the vital infrastructure of our healthcare system. And as the Centers for Medicare and Medicaid Innovation and CMS, who can drive the federal payment, move into value-based arrangements, and as more private and commercial begin to move, I think we're going to start to see those numbers shift. So, it seems to me that we're really in this evolution. I think there's been a lot of talk about value-based payment for decades, and we haven't actually seen a lot of it, truly transform clinical care. we need a lot more of the revenue into any primary care practices to be capitated. Because if it's one payer, that's not going to make a difference. A study out of the Harvard Center for Primary Care says that about 2/3 of your practice revenue needs to be, capitated for you to feel that you can hire the team and for it to really flip your delivery model away from fee for service and, the sort of visit-based approach, whether it's in person or virtual, to deliver care in different ways. A group visit, a quick touch over email, really change the mindset and the approach to care. So we're on that journey. We have a ways to go. And we also, I think, really want to make sure that as we go along, and I think we're moving in the right direction, we've got really good guardrails in place to make sure that patients, people that are quote unquote in the safety net or those that are safety net practices can, partake in these value-based payment models. And that's going to take, additional considerations around how do you adjust performance measures? How do you provide upfront investment to those safety net practices? Because they don't have the IT infrastructure to manage risk. So there's a lot of things we need to do to make sure that primary care can be there in all communities, not just for those that may happen to be in a Medicare Advantage plan or, are in a large practice that can handle risk. So we need to be aware of guardrails and making sure that, as you pointed out earlier on, Seth, that everybody can take advantage of what the National Academy of Science, Engineering, and Medicine calls a public good, primary care.
Yeah, that's what I was thinking of too when Seth asked this question, and is really that the front line where a care team or physician, clinician is facing off with a person, and because that's where I guess it happens, right? And is that a better experience? Is it a more complete, effective in terms of supporting an individual than are the teams who are having to provide that care being supported to the full extent that they can? And I know one of the things that you work on is the notion of an evidence report. So what are some of the areas that maybe you're focused on in terms of conveying the evidence of progress, and what's holding us back on getting more money flowing into primary care or getting more reimbursement support for some of the things that you'd referenced?
Well, I think our entire system needs to flip to being incented to keep people healthy. So it can't just be primary care incented in that way. I mean, hospitals need to be incented in that way. Specialists need to be incented in that way. The entire health system needs to have a different incentive model.
Yeah, and people need to be accountable too, right? I mean, that's
totally. I completely agree. Like, there's lots of things that need to change. We don't necessarily have a culture that we all would love to, just, I don't feel like running this morning. I'm going to take this pill and I'm done. Right. We all need to partake in keeping ourselves healthy, and that's work. That is work. So I agree there. So anyway, I think that, we don't flip all of our healthcare system until it's all incented around population health and equity.
Yeah. And from what you're seeing, Seth, so you referenced how investment money flowing into the space, formation of companies, some of them being consolidated into larger entities. How, from your vantage, are you seeing the support and change making it to the front line of care? In the experience that we were just talking about. So how are these organizations delivering on the vision?
Great question, and I'll answer it in two ways. There's enormous investment, but Sean, you asked the question, how is that investment sort of making its way to the front line of care? And as an aside, I think that's where there's a gap, right? There's been enormous investment. Venture capital investment hit record highs in 2021 as we went through the public health emergency and COVID. There was the relaxation of telehealth waivers. There was a lot of investment and enthusiasm around digital health writ large. And yet, I think many of the companies that raised funds during this time thought they might be able to go direct to consumer. Now, consumer sentiment, it's pretty clear, is such that people value their relationships with their doctors, with their primary care physicians, and they want to maintain those relationships. And so questions are around whether some of these companies can pivot and bring their solutions and effectively find ways to support the existing healthcare delivery system in a way that, for instance, Innovator has been doing for years now in I think, a very healthy, productive way. But on a different tack, what I would say is it's really interesting because we talked earlier, and you mentioned, the issues around fragmentation, and I've talked as well about the challenges of fragmentation. And with all of this new investment, we've got so many startups. And you mentioned, the problem if you've got, a patient with multiple different digital health solutions, well, what are we asking of that person to do? And what should we be asking? And is that realistic? And the answer is, in most cases, no. And we could say likewise of all these digital health solutions that are pitching their technology to doctors, to primary care. They may say, oh, well, it's a simple click and you've got a dashboard, or we can integrate with your EHR. Well, yeah, that's true, but that requires real work to integrate that, to make use of it. Still requires some of the doctor's time or the admin's time. And so there's this struggle, I think, between, well, the best solutions are those that are going to be relatively more narrow to start. They'll pinpoint a specific problem and focus and become best in class at that. And yet we can't have too many of those, because then we wind up with the point solution problem and fragmentation. And so there are, I think we're working through this period of how do we stitch together these different solutions in a way that work for providers and for patients. And some of that work I expect is going to be done by the providers or patients themselves in a suboptimal way. Some of that work may be done because the provider groups are substantially larger and they have capacity to figure out how to stitch these different solutions together. And then hopefully what we also have are middle layer solutions that have been successful in the market and expose their APIs and are able to integrate other solutions into them in a fashion that I can say that I understand Innovator has, which is Innovator has been very successful and now has a marketplace which allows other third-party technology developers to integrate with and sell into in a way that they are no longer become point solutions. So I'm optimistic. I expect this is going to take a lot of time, and I'm curious. I know we're short on time to hear about each of your thoughts about that.
Well, I'll comment, and then I'll pose a question as we maybe wrap this series of the seminar up, or the webinar up. A comment is, we've had a belief that now that the industry, and this is really something that just occurred over the last decade, has transitioned from being largely paper-based to digital. There's an incredible opportunity to take advantage of the data resources, and we're really still in the early stages of how that information is accessed, how it flows, how it's secured and trusted in a way that people are confident using it. That's a significant aspect of our focus. Ann and I have talked about this, the challenges of communication, education, and awareness in this industry, and some of the dichotomies that exist. We've spent a fair amount of time in this call talking about payment structures and reimbursement. And when I go for healthcare, why should I care if it's value-based service or what kind of contract or it's fee-for-service? I just want care. And I think the care teams, the physicians, they just want to take care of you and care for you. And yet this is kind of in the middle of how people experience and access care, and it results in all kinds of inequities and inefficiencies. And so the question that I had in mind is, how can we, maybe what are some ideas for things that we might explore further through this webinar or dialogue to help us get close to where innovation is occurring that really does matter? What's happening at the front line in terms of those who are trying to deliver an experience and fulfill what they, their chosen career was about. And then also, at the individual, the community, the individual level of receiving care. So my question maybe to both of you is, what might be some things that we could help explore further to get at this question and help advance? It's, healthcare, my final thought is healthcare, it's a $4 trillion industry, roughly 20% of our economy, one of the largest sources of employment. And on the one hand, it's an incredible aspect of economic progression and growth, but it's also an encumbrance in many respects because it's inefficient as it's structured that you've highlighted. It's almost like a tax on the effectiveness of our economy. So fundamental issues to address. So what are some thoughts on what we could explore further to help advance this cause that I think we share together?
Well, I guess I would jump in and say it's an economic drag, but it's also, unfortunately, we're not getting value, right? Because we're doing so poorly in terms of our health outcomes, and that doesn't make any of us happy because a big expenditure without achieving what we would all hope is health. So, Sean, I think it would be very interesting to have some conversations with innovators who have changed their payment structures and their care delivery supported by technology. Because when I have conversations like that with those who are practicing in those environments, those primary care doctors and NPs and PAs are really excited about the care that they can deliver. They feel freed up to be creative in how they approach solving for the issues that their patients have. And so I think talking to some innovators would be terrific to give people also some hope that it is happening out there. It may not be as fast as we'd like, but it is happening. And then the real question is, how do we scale? Because we've got so many great innovators in this country, and there's so much that is truly remarkable. And yet, what we need to do is scale so that folks in all communities have access to this great innovation.
Well said. Seth, do you want to add to that?
Oh, sure. I think that was fantastic. I wholeheartedly agree. And so just a couple of additional thoughts. I think Anne has been spot on in highlighting the need for smarter policy and smarter payment systems. And from that, virtually everything will follow. And we've started to see that. I think what might be interesting, in addition to hearing from the startups, is even from some investors, how do they think? How are they tracking some of the policy changes? And what is the timeline that they are thinking of in terms of starting to make some investments and seeing how those turn out over time? How do they think about these changes? Where do they see opportunity? And then also, I don't want to miss, I got an email the other day from a primary care physician who he did not mention the word burnout. He currently works for a system, but he disheartened certainly, I think is a fair characterization. And he was asking for my counsel. And I said, well, first off, I'm not a practicing doctor, so I want to be really respectful of that. But it was interesting because I look at the broader trends and gosh, there are so many reasons to be optimistic, excited, to think that there are more opportunities than ever for people and for providers. I am really excited about organizations that are providing technology and services to independent primary care physicians to allow them to participate in risk-based contracting arrangements. That's exciting. And then, so whether it is engaging one of those companies or looking at joining one of these startup companies that takes on risk and becoming an employed physician there, whether there are other telehealth options, there's a lot of reason, I think, at a higher level. And I want to, again, be respectful at saying, I don't know this individual's life circumstances, the unique geography, the patient panel, or anything about that. So it's just interesting. I think it would be interesting to bring on some practicing physicians as well as to make sure we're tying the theory, the policy, the investment discussions back down to the reality of what it looks like to practice on the ground today.
Yeah. The dichotomy is that you described and Anne referenced. It's quite extreme from just absolute, disenfranchisement, disheartenment, and to the other hand, really liberating and energizing when it's coming together and working. And so let's explore that. And we can invite I certainly have some organizations in mind across this continuum. So I think if we could hit some of these frontline innovators and what their experience, I think the investment community and what's their thesis for why they're applying capital into the space and their risks and concerns about it. I think it will also be good to explore, Seth, like some of the scale entities and who are acquiring these organizations or believing that their businesses need to evolve to accommodate some of these things, how and why they're doing it. Ultimately, I think this is something, it's an incredibly important topic for our economy. The ranges of what we're experiencing in different places and different businesses and different practices is quite extreme. And how can we take some of, I think, the most encouraging, insightful, and effective approaches and make those more broadly accessible? Well,
absolutely.
So I allow you both, if there are any closing comments, I'd welcome you both to add it. This is, from my perspective, the rich discussion that I had expected but we would have with both of you, and so much more to explore. So it's maybe chapters in a book that will continue to engage together and open and see if we can take that experience further.
I just want to thank you, Sean. You've been a great moderator, and you bring so much expertise into the conversation. So thank you. And it was wonderful to have the chance to speak with you again, Seth. I admire your work. So thank you. And I look forward to continued conversations, because I think the sorts of individuals that you identified, it would be wonderful to gain their perspectives.
Ditto. Always humbling engaging with both of you. It's important work. So thank you for sharing your time with us. And we'll look forward to the next session on the Innovator Accelerator program.
You've been listening to the Innovation Accelerator podcast, brought to you by Innovator, the data platform that accelerates innovation in healthcare. Don't forget to check the show notes for links to related resources and other information. And stay tuned to the Innovation Accelerator podcast for more programs about the healthcare IT topics you care about. Accelerate innovation, digital transformation, and your success with population health, customer relationship management, and value-based care with Innovator. For more information, please visit innovator.com.